Hello, good day everyone. I am Crisantahero Caparos from BSN1 11G. And so for today, I am going to perform a proper return demonstration about the assessment of cardiovascular system. So cardiovascular system is an organ system that permits blood to circulate and transport nutrients, oxygen, carbon dioxide, and hormones and blood cells and from the cell of the body, and it provides nourishment, fight disease, and establish the temperature and maintain homeostasis. So first is we need to check for the patient's medical record if any. Next is we need to determine the scope of the assessment and prepare the equipment to be needed. So we have the stethoscope, the centimeter ruler, the pen light, the surgical gloves, the comprehensive form, and also alcohol. And don't forget to perform hand hygiene to deter the spread of a microorganism. And don gloves if necessary. So I already closed the door, fix all the curtains, and provide adequate lighting for my patient's comfort and privacy. So hello, good day ma'am. How are you feeling today?
I'm good.
Okay, so it is important to greet the client to establish a good rapport between the healthcare provider and the client. So, hello ma'am, good day. I am Crisantahero Caparas, your student nurse. Can you state your full name please? Okay, when is your birthday ma'am?
September 16, 2024.
Okay, what do you want me to call you ma'am?
Queen.
Okay, Ma'am Queen, what language do you prefer me to use? English or Bisaya?
And
Okay. So, ma'am, the procedure that I will be doing is to assess for your cardiovascular system or your heart. So, this is to determine whether there are any peace or any abnormalities in your heart, and there are any certain procedure that you need to follow, and I'm going to touch some parts of your body. Is that okay with you, ma'am? Okay, thank you. So, are there any clarifications or questions before we proceed to the next procedure? Okay, so, ma'am, I'm going to ask you some question. It is okay with you? Okay, so do you feel any chest pain? Okay, so do you have any past health history such as myocardial infection? Okay, so how about your lifestyle habit? Is this okay?
yes.
Okay, so that's great. So now I am going to proceed to the assessment of jugular veins. Stood the right side of the client and position the client supine with the head and of the bed elevated between 30 and 40 degrees, making sure that the head and torso are the same plane. Then instructed the client to turn the head slightly to the left and shown tangential light source onto the neck. Suprasternal notch and area around the clavicles to observe the pulsation and shadows. So, Ma'am Queen, I am going to show a light. So, please turn your head to the left side. Okay, so turn your head to the right side. Okay, thank you. So, if jugular distension was noted, assess the jugular venous pressure by locating the highest visible point of distension of the internal jugular veins. Emphasize the distension with tangential lighting. Then, as deemed necessary, raise or lower the head of the bed to 30 to 45 or 60 and 90 degrees until the highest visible point of distension of the internal jugular vein was observed. Then measure the vertical distance in centimeters above the sternal angle by extending a long rectangular object or card horizontally from this point and a centimeter ruler vertically from the sternal angle, making an exact right angle. Repeated the preceding step on the other side. Okay, so on the other side, ma'am. Okay. So now I am going to proceed to the assessment of the carotid arteries. With the head of the bed still slightly elevated at 30 degrees, position the client head slightly towards the side being examined. Palpate the carotid artery cautiously, avoiding too much pressure or massaging the area. Repeated the preceding step on the other side. Okay, so ma'am, can you turn your head into left side? Okay, the other side, ma'am. Okay. So, next, turn the client's head slightly away from the side being examined. Place the bell of the stethoscope over the carotid artery. Ask the client to hold his or her breath for a moment. And auscultate the carotid artery, listening for breath. If a breath was heard, gently palpate the artery to determine the presence of the trill. Repeated the preceding step on the other side. Okay, ma'am, can you turn your head? And please hold your breath for me, please. Okay, into the other side, ma'am. Okay, thank you. So now let's proceed to the inspection and palpation. Began with the general inspection of the chest wall in women. Keep the right chest draped, gently lifted the breast with the left hand, or ask the woman to do this for assistant. Stood at the right side of the client with the head and bed elevated at 30 degrees and look for any abnormal pulsations. Shown a tangential light across the chest wall over the cardiac apex to make sure these movements more visible. Okay, so ma'am, can you hold it for me? And I'm going to inspect for the chest. And I'm going to show a light. It is okay with you, ma'am? Okay. Simultaneously inspected the pericardium for pulsation while palpating aortic area, pulmonic area, tricuspid area, and apical area. Following the technical below, palpated for hips and lips using the palm and or hold finger pads flat or obliquely against the chest of the client. So for trills, press the ball of the hand firmly on the chest to check for a bustling or vibratory sensation caused by underlying turbulent flow. So, palpated the impulses using finger pads flatly or obliquely on the body surface from the aortic area, pulmonic area, and tricuspid area. RV in the right ventricular area at the lower left sternal border, and in the subxiphoid area using the palmar surface of the hand. Then palpated the apical impulse using the palmar surface of 2 or 3 middle fingers. Then for finer assessment, palpated with one finger done to confirm the characteristic of the apical impulse, noting for location, diameter, and aptitude. If unable to palpate the apical impulse with the patient supine, reposition the patient to roll partly onto the left lateral side. Palpated again by using the palmar surface and of several fingers. If still unable to palpate, ask the patient to exhale fully and stop breathing for a few seconds. And palpate again while patient maintained to be partly facing his or her left side. Then expected and palpated for the epigastric area at the base of the sternum or for abdominal aortic pulsation. Okay, ma'am, can you face here for me? Okay. So, now we are going to proceed to the auscultation. Assess for the heart rate and rhythm by placing the diaphragm of the stethoscope at the apex and listening closely to the rate and rhythm of the apical impulse. Counted the heartbeat for a full minute. If an irregular rhythm was detected, assess for a pulse rate deficit. Using the diaphragm of the stethoscope first, then the bell. Auscultated the heart anatomic sites, aortic, pulmonic, tricuspid, and the apical or mitral for the heart sound. Extra heart sounds and murmurs. Ask the client to be breathe regularly while auscultating. Repeated the preceding step while patients is in the lateral position, then at the sitting position, leaning forward and briefly stop breathing after exhalation. So, thanks. Then, can you sit down for me, ma'am? Inhale. Exhale. Inhale. Exhale. Okay. Okay, so now, ma'am, I am going to examine for your extremities. Assess each arm for size, symmetry, skin color, and temperature from the fingertips to shoulders. Note for any presence of edema, lesions, changes in skin, texture, and hair distribution. Okay, so that the temperature of your skin is normal and your hair is evenly distributed. So now I am going to inspect for the peripheral veins, the arms for the presence and or appearance of superficial veins when limbs are dependent and when limbs are elevated. Okay, so now I am going to palpate for radial pulse, ornal pulse, and brachial pulse individually and bilaterally. Next is I am going to assess for the capillary refill. Next is perform the Allen test. Stop, open. Okay, the other hand. Stop, open. Okay, good. Then, repeated the preceding step on the other arm. Examining lower extremities. At a supine position, assess each leg for the size, symmetry, skin color, and temperature from groin to toes. Noted for any presence of lesions, changes in skin color, texture, and hair distribution. Okay, as I can see that your skin is intact and your skin is warm to touch, and also the hair is evenly distributed to the other foot. Okay, thank you. So now I am going to inspect for the peripheral veins in the legs for the presence and or appearance of superficial veins when limbs are dependent and when limbs are elevated. Okay, it's good. The other. Okay. Then palpated for the femoral pulse, popliteal pulse, dorsalis pedis, and posterior tibialis, individually and bilaterally. Assess the peripheral leg veins for signs of ulcerations, varicosities, and thrombophlebitis. Inspected the calves for ulcerations, varicosities, redness, and swelling over the veins. Okay. Okay, thank you, ma'am. So now I am going to palpate for the calves for firmities or tension of the muscles, the presence of edema over the dorsum of the foot, and areas of localized warmth. Then push the calves from the other side to test for tenderness. Okay, so that's great. So now I am going to firmly dorsiflex the client foot while supporting the entire leg in extension, or perform the Horman's test, or have the client stand or walk. Okay, ma'am, can you walk for me, please? Okay, thank you, ma'am. You may back to your... Okay, the other foot. Okay. So next, I am going to assess for the capillary refill for both legs and repeated the preceding step with the other leg. To the other side. Okay. Then now inform the client assessment was done. If deemed necessary, assist the client to change clothes, reposition the client comfortably sitting on a chair. Then summarize the information obtained during the working phase and discuss findings to the client. Discuss to the client possible plans to resolve health concerns if present. Assess for client's understanding for the plan and the need for further teaching, provided the client the opportunity to clarify, ask, or raise any concerns. Thank the client for his or her cooperation and ended the assessment politely. Done aftercare, perform hand hygiene. Then documented the findings in the client record using printed or electronic forms or checklist supplementary by narrative notes when appropriate. Okay, so ma'am, since we're done with the assessment, are there any concerns or any clarifications? Okay, thank you ma'am. So thank you for your cooperations and have a great day ahead. Then don't forget to perform hand hygiene to deter the spread of a microorganism.